Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's December 2023 issue. There are 3 articles that have been selected as our editor's choice or highlight articles this month. Our editor's choice in this month's Mayo Clinic Proceedings is a special article entitled Community Health Partners in Unexpected Places. It is authored by Dr. Michael K. Hole from the University of Texas at Austin and colleagues from several U.S. institutes, universities, and companies in New York, Texas, and Washington, D.C. There are opportunities for healthcare promotion and provision in the community that go beyond traditional healthcare systems, hospitals, and outpatient clinics. And the potential of such hidden in plain sight opportunities remains largely untapped. In an article filled with insight, understanding, and humanity, Hole et al. Delineate such opportunities in the community and ones that may be particularly beneficial in reducing healthcare disparities recognized in African Americans, Hispanic Americans, other minorities, and in rural communities. The authors begin their discussion by emphasizing the importance of patient trust and ready patient access in ensuring effective health care, and they elucidate how several places may promote and provide such health care. Such places include libraries, places of worship, laundromats, barbershops, fire and police departments, dollar stores, and shopping malls. For example, public libraries, which are iconic community forums of knowledge and acceptance, provide general healthcare information and specific information with the aid of a librarian. Some libraries engage healthcare professionals to provide aspects of healthcare and screening and counseling and for medical referrals. Other libraries engage specially trained librarians to assist community members to apply for health care and other public benefits. Places of worship are positioned to promote health care as they are trusted by their members who in general regularly attend services. For example, during the COVID-19 pandemic, several faith organizations were able to increase vaccination rates in vaccine-hesitant members. As another example of such opportunities, in an initiative involving 52 barbershops in Los Angeles, and based on a pharmacist-led, physician-supervised program to reduce blood pressure, impressive improvement in blood pressure control was achieved by such a program in the community. Hole et al. Underscore the bidirectional nature of this community service and the health system partnership. Health systems first engage appropriate community services, which then reciprocate by partnering with health systems. The authors discuss specific elements that have enabled such relationships to succeed: delineating common ground, ensuring transparent data, active listening, recruiting facilitators, and publicly celebrating success. Especially in the current climate, healthcare and healthcare reform require innovative approaches. The innovative and timely strategies discussed by Hole et al. Demonstrate how existing, trusted, readily accessible community services can engage with health systems so as to provide access to healthcare and hopefully to reduce healthcare disparities. Our first highlight article this month is an original article entitled Assessment of Adverse Childhood Experiences, Adverse Professional Experiences, Depression and Burnout in U.S. Physicians. It is authored by Dr. Mickey Trockler and colleagues from Stanford University School of Medicine in Palo Alto, California, and colleagues from Mayo Clinic in Rochester, Minnesota, the University of Colorado School of Medicine in Aurora, Colorado, and the American Medical Association in Chicago, Illinois. Physician burnout adversely affects physicians themselves, the patient care they provide, and the functionality and costs of healthcare systems they serve. Physician burnout predisposes to personal healthcare risks, including depression, which is rising in prevalence. Truckle et al. Examined the extent to which adverse childhood experiences and adverse occupational experiences associated with burnout and depression in U.S. physicians. Adverse childhood experiences included emotional abuse by a household member or living with a household member with substance abuse. Adverse occupational experiences included an adverse COVID-19 related experience, involvement in a malpractice suit, or making a medical error that adversely affected patients. The data are telling. 24% of all physicians responding to the survey experienced at least one of the adverse childhood experiences. More than 50% of physicians experience a COVID-19 related adverse occupational experience. Almost 10% were involved in a malpractice suit, while 7.5% responded that they made a medical error that adversely affected patients. Burnout was significantly associated with adverse childhood experiences, COVID-19 related adverse occupational experiences, and medical errors. Mild to severe depression was associated with all adverse childhood experiences and adverse occupational experiences. The authors provide context for and the significance of their findings by emphasizing the following considerations. First, burnout in U.S. physicians is more prevalent than in workers in other fields and professions, whereas depression is generally comparable across these various fields. Second, while burnout and depression are distinct entities, a relationship exists between them. Burnout concomitantly exists in the majority of physicians with severe depression, and a subset of physicians with burnout will have depressive symptoms. Third, their findings as regards the implications of adverse childhood experiences and adverse occupational experiences suggest that screening for them in physicians may offer a strategy in evaluating burnout and depression in physicians. Fourth, and especially related to the prior consideration, physicians tend to shy away from participating in screening for depression in adults, a practice generally recommended by the U.S. Preventive Services Task Force. Perhaps, as suggested by the authors, physicians may more likely participate in screening for such adverse experiences, the findings of which, in turn, may adumbrate the likelihood of depression. The important and timely study by Truckle et al. Delineates salient, distant, and recent stressors that may significantly compromise physician well-being. Our second highlight article this month is an original article entitled Benefit of Anticoagulation Early After Surgical Aortic Valve Replacement Using Bioprosthetic Valves. It is authored by Dr. Ying Huang and colleagues from Mayo Clinic, Rochester, Minnesota. Surgical replacement of a diseased aortic valve by a prosthetic valve has the potential advantage that chronic anticoagulation with a vitamin K antagonist may not be needed. Expert guidelines, however, advise consideration of such therapy for several months after surgical replacement in patients with low risks for bleeding complications. The prescription of warfarin after surgery, however, is generally low, in part because of conflicting data regarding the beneficial effects of such therapy. Huang et al. Examined this issue using the Optum Labs data warehouse to determine outcomes in adults who underwent bioprosthetic surgical replacement of a diseased aortic valve either with or without coronary artery bypass. Two groups of patients were studied, those not treated with warfarin and those prescribed warfarin for more than 30 days after surgical replacement of a diseased aortic valve. Propensity score matching was used to balance the baseline characteristics. The final analysis involved almost 3,000 pairs of patients who underwent surgical replacement of a diseased aortic valve between January 1st, 2007 through December 31st, 2019. The findings demonstrate that through 2 years of follow-up, there was a 32% significant reduction in mortality in patients receiving warfarin compared with those not on warfarin. Additionally, in the warfarin-treated patients, there was a trend towards reduction in the cumulative incidence of thromboembolic events. However, in the warfarin-treated patients, there was a significantly higher cumulative incidence of major bleeding episodes compared with patients not treated with warfarin. Interestingly, the risks of bleeding in warfarin-treated patients were not greater in those with a higher has-bled score. These findings occurred in warfarin-treated patients irrespective of whether coronary artery bypass grafting was also performed at the time of surgical replacement of a diseased aortic valve. The authors point out that major strengths of their study include the fact that most other studies use intention to treat analyses to assess patient survival and evaluated only 3-month survival. Additionally, this study by Huang et al., including patients with preoperative atrial fibrillation and those who developed atrial fibrillation in the early postoperative period. Based on the present findings, Huang et al. Recommend that after bioprosthetic surgical replacement of a diseased aortic valve and in appropriately selected patients, the early use of warfarin therapy is recommended. You can access these highlights and editor's choice articles free of charge during the entire month of December. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find our online-only features and many news stories posted in the News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will also see other free content as well as articles published online in press. Please check out our newest addition to the Pioneers and Legends video recordings featuring an interview with Dr. Michael Camilleri, hosted by Dr. Scott Wright. You will also find links to our social media by clicking the buttons at the bottom of the home page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights and our Mayo Clinic Proceedings 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are available from our website on the home page, as well as through iTunes. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.